there is a big awareness now with the evident link between climate and health. It's important to mention that the health sector is responsible for almost 5% of the greenhouse gas emission annually. And to put this into perspective, if the healthcare sector were a country, it would be the fifth largest emitter on Earth after China, United States, India, and Russia. And it's equivalent to the annual greenhouse gas emissions from 514 coal-fired manufacturing plants. So it's huge. AstraZeneca is one of the first companies to commit to reducing carbon emissions and using clean energy across its operation to achieve net zero by year 2045, and we have pledged for this globally.
Welcome to the Health Beats podcast, brought to you by Abu Dhabi Global Healthcare Week. The Health Beats podcast series is your window into healthcare industry news making headlines and the role of Abu Dhabi and the UAE in unlocking global healthcare momentum. We give you insights into the future of the global healthcare sector and Abu Dhabi's contribution to it. I'm your host, Lara Satrakian, and today we're speaking to Sameh Al-Fangari, Cluster President for the GCC and Pakistan at AstraZeneca. Our conversation today is entitled The Intersection of Health and Climate, an Urgent Global Priority. Sameh, welcome to the podcast.
Hi, Lara, and thanks for having me.
We have so much to talk about. Let's jump right in. How does climate change directly and indirectly impact human health on a global scale?
Yeah, thanks, Lara, for the question. I think the climate change has a profound and undeniable link to the human health, both directly and indirectly. So, as you mentioned, if we talk about the direct link of the climate change, it is the biggest crisis of all times, and we already affected, with it every day. And, there is an estimation that currently 13 million people die annually out of the climate change effect. This includes the floods, includes the extreme heat, which is, and just to put it in a perspective, is like the double the impact of losses, unfortunately, we had during COVID time. But the indirect impact is quite obvious as well. So we can see that there is a tremendous rise and exacerbation of some non-communicable diseases linked directly to the extreme heat and the climate change. And we can see this in the respiratory illnesses, cancer, heart conditions, as well as some infectious disease as well. This worsening of the health conditions jeopardizing access to basic health care and disproportionately as well impacting the most vulnerable population in our planet. Consequently, the increased demand puts even greater pressure on already stretched health systems worldwide.
What are the most significant health challenges that you see exacerbated by climate change?
Yeah, so as I mentioned, the climate crisis is the largest public health crisis of our time, presenting significant health challenges and immense strains on the health systems. So if we zoom in the non-communicable diseases, for example, that chronic respiratory diseases are aggravated by rising temperature and pollution levels. Every 2 seconds, there's someone aged between 30 to 70 years dies prematurely from non-communicable diseases. The increased prevalence of these diseases, driven by environmental factors, further strains health systems already struggling to cope with the increasing demand for better healthcare services. And if I talk about the respiratory diseases, there are estimation of 7 million premature deaths globally each year. Over the last 30 years, for example, lung cancer and respiratory-related diseases linked to air pollution have increased by 160%, heavily burdening healthcare systems, requiring more resources and infrastructure to manage and to treat these conditions. But more interestingly, the patient pathway itself in the healthcare has a big impact on the environment. This pathway includes traveling from and to the hospitals, using the facilities, including the diagnostic equipment and machinery, medicines, and the energy needed by the hospitals and the clinics to cater for the increased number of patients visiting those healthcare facilities. Each step produces carbon emission, from making and disposing of medical supplies to the energy needed for tests and treatments. Frequent hospital visits and long stays increase emissions as well. So it's like a vicious cycle.
What are the long-term implications of inaction on this combined health and climate crisis? What's the urgency in your mind for immediate action?
So it's obvious that the inaction will lead to the further escalation of this vicious cycle, and leading to more health crises in the near future, with rising incidences of chronic and infectious diseases, increased mortality rates with extreme weather events, and further degradation of the air quality. All of these will put further strains on the health systems. And as a patient-centric organization, we at AstraZeneca can only say that we are doing everything possible to save humanity only when we are taking radical actions and immediate actions on climate emergencies. And the urgency for immediate actions cannot be overstated here. We need to integrate climate actions into health policies and practice changes sustainably. Low carbon healthcare by leveraging the power of science and public-private partnership, which is critical in this case because we cannot do it on our own. No one can do it on their own. We have to collaboratively work together on this. We can build more resilient health systems and ensure equitable access for healthcare. This proactive approach is crucial to safeguarding both the public health and as well as the environment, and ultimately benefiting the people, society, and the planet.
How can the healthcare sector, especially pharmaceutical companies, contribute to mitigating the effects of the health risks associated with climate change?
Yeah, I think that despite that there is a big awareness now with the evident link between climate and health, it's important to mention that the health sector is responsible for almost 5% of the greenhouse gas emission annually. And to put this into perspective, if the healthcare sector were a country, it would be the fifth largest emitter on Earth after China, United States, India, and Russia. And it's equivalent to the annual greenhouse gas emissions from 514 coal-fired manufacturing plants. So it's huge. AstraZeneca is one of the first companies to commit to reducing carbon emissions and using clean energy across its operation to achieve net zero by year 2045, and we have pledged for this globally. So AstraZeneca was one of the first companies to commit to reducing carbon emission and using the clean energy to achieve net zero by 2045. This is our global commitment, but we are also committing to the GCC pledge to the net zero, including the United Arab Emirates. This was pledged during the COP28 to reach net zero by 2050. But just to understand that we are not only inspired by vision, we are doing things as we speak today. So in the last 10 years and since 2015, we're doubled in terms of size, in terms of people, revenue, and size of the operation and business, but we're able to halve our carbon footprint. And we were also recently recognized by the Forbes as one of the global net zero leaders of 2024. 50% of the carbon emission sits within our operation, and 50% of the carbon emission sits with the healthcare delivery itself at the hospitals and the clinics. And that's why we are not stopping only into our commitment towards decarbonizing our operation, but we would like to work collaboratively with the healthcare provision in order to decarbonize the patient pathway and the patient care, ultimately to achieve a holistic end-to-end impact. And we need to rethink the hospital care pathway for the benefits of the patient and the planet. And being sick means that you need to go to the hospital, you need to be embarked on diagnosis journey, then treatment journey, and this is very carbon intensive in nature. So we must all work into early detecting the patients and ideally preventing illness to happen in the first place, so we are able to create the impact across the value chain.
Preventive care and preventive carbon footprint of care. It's a very interesting idea. What are the other economic and social implications of trying to tackle the health and climate crisis together? And how do you workshop all of that to become really a blueprint for a just transition?
So AstraZeneca is a science and innovation led organization, and through our scientific approach, we can really understand that some diseases are more carbon intensive than the others, which is why the need arises to rethink the hospital care pathway for the benefits of the patient, the economy, and the planet, with focus on the carbon intensive diseases. This reaffirms the needs of the decarbonization of the patient care pathway. Simply putting decarbonization, just to explain it a bit, it's referred to the removal or reduction of the carbon dioxide output in the atmosphere that, resulting from the diagnosis and treatment of a patient in a healthcare facility. So in general, this can be achieved by switching to usage of low carbon energy sources like the renewable energy, reducing waste and water consumption. However, in healthcare, it requires a more collective effort and more innovation than that, for the healthcare ecosystem itself. And I can give an example of one of the diseases, like the chronic kidney disease. This is one of the intense, health intense and carbon intense patient pathway. And globally, 1 in 10 people have a chronic kidney disease. This can be resulting from being a diabetic patient, progression of a diabetic patient, or even non-diabetics with other risk factors. But it's a huge burden, for the patient, for their caregivers, and for the healthcare system. And this means patients often miss out on earlier diagnosis and always being picked up late in the treatment journey. And when they are progressed into a late stage, they becomes even more carbon intensive, because those patients unfortunately can go to a dialysis or can go into kidney transplants. And in the United Arab Emirates, the at-risk population prevalence for hypertension and type 2 diabetes, obesity, and smoking, all of these are linked to the chronic kidney diseases, and is one of the United Arab Emirates, compared to the developed nations, is on the higher end of that incidences. So what is the social impact of this? So the social impact is obvious, that the chronic kidney disease symptoms can significantly impacting person's quality of life, and there, of course, the morbidity and the mortality. The economic impact is putting huge, heavy budget on the shoulders of the government and healthcare givers, and it's estimated that in 2027 that this can reach to around $800 million. On the environment impact, as I mentioned, if the patient progressed to dialysis, there is an increase 5 times of the carbon emission compared if the patient are diagnosed earlier. So back to the point that we just discussed, Lara, that if the patient is early diagnosed, ideally prevented, and properly treated, that this can help to reduce significantly the impact of the carbon emission of the chronic kidney disease patient, which was estimated for the UAE to generate around 220,000 tons of CO2 annually. And just to give an analogy of that, this is equivalent to 356 flights circling around the globe every year.
What are some successful initiatives or projects that have really demonstrated the synergy between health and environmental considerations? What can we learn from case studies? Anything that comes to mind?
Yeah, I think that just like we are part of the problem. As I just mentioned, because it's a vicious cycle between the climate action and health. We should be part of the solution as well, and we cannot do this on our own. We have to work collaboratively with all of the stakeholders in the ecosystem. But in order to do this in a very structured way, we have a global strategy that built over 3 pillars. So it's resilience, healthcare system resilience, health equity, and the climate action. And I can give a little bit of a glimpse of what we are doing, especially locally here within United Arab Emirates and across GCC, on these 3 pillars. So when it comes to the resilience, we have learned during the pandemic that the healthcare sector is very vulnerable to any shock that can put the entire system into a big issue to recover again. So we have worked closely with the government and with the support of the global stakeholders like World Economic Forum and London School of Economics, because it takes academia as well to be part of that, and with the Department of Health in Abu Dhabi, trying to understand the baseline that we have in the healthcare ecosystem and potential gaps that may happen in the future in front of facing future pandemic. And then it was a great opportunity during the Abu Dhabi Global Health Week that UAE have launched the Abu Dhabi report of the PHSR, of what we call the Partnership for Healthcare Resilience and Sustainability. So that's an important part, because we cannot do anything if the foundation of the healthcare system itself is not being thought of. Second part is the health equity. This is the second pillar. Health equity here goes beyond what we usually think about the affordability of the healthcare system. It goes to what we just discussed earlier about having an equitable access for all patient population to early diagnosis and early detection. And we are very proud that we are partnering with the Abu Dhabi public health sector in a couple of very important initiatives. One of them was the chronic kidney disease, as I just mentioned earlier. And the second one is Change the Story, which is focusing on early detection of breast cancer patients. So going into doing campaigns for early screening and detecting those patients and treating them as early as possible will definitely benefit the patients, which is the impact on the people. It will impact as well on positively on saving a lot of budget going forward if the patient are picked up late in the diagnosis, as well as the third pillar. We talk about the climate action, and they are all, if you can see that the three pillars are interlinked together. So in the climate action, we give the example of the decarbonization of the patient pathway. We are transitioning as well in our global operation, as I mentioned earlier, to renewable energy. And we aim of achieving in scope 1 and 2, based on the science-based targets, achieving 98% reduction in our overall carbon emission. But we are as well thinking of the design of our products, and we know that inhalers to treat some respiratory diseases like asthma, for example, is not eco-friendly as it says today, but we are partnering globally to transition all of our inhalers to an eco-friendly devices, which will help, of course, in reducing the carbon emission. Moreover, that we are as well working into changing the leaflets, the patient leaflets in our medicines, to make it more electronic and digital, easy to be accessible for patients, but as well, it's a big saving in terms of carbon emission. The other things that we are doing as well locally here, that we are involving ourselves into supporting the forestation initiatives, and we AstraZeneca proudly last year we planted 10,000 mangroves in the UAE and another 5,000 trees in Saudi. It's just symbolic, it's just a start, but we continue to do that. Yeah, and in the UAE we have just moved our offices just before the COP28 last year in September into a sustainable office, LEED certified office. This will help us to reduce the day-to-day carbon emission in our offices here in locally in the United Arab Emirates.
Samih, you mentioned Abu Dhabi Global Healthcare Week. We both had a chance to be there in May 2024. It was the first edition. What was AstraZeneca hoping to achieve? How did it go? What did you learn? What were some of your big takeaways? What did the event provide in terms of opportunities to pursue really important goals?
Yeah, I think that the Abu Dhabi Global Health Week was an exceptional event. We have seen the inspiration that comes from the Abu Dhabi strong vision, into building much more sustainable healthcare, and we're very proud to be chosen to be the sustainable healthcare partner for the Department of Health in Abu Dhabi Global Health Week. And we have seen as well the leadership vision into transitioning the healthcare into health for all, which is, encompassing everything that we spoke about, early detection, diagnosis, and making sure that we are only building up the healthcare system to cater for the sick people, but actually preventing them from being sick in the first place. It was as well an amazing forum to launch the Abu Dhabi report for the PHSR. So we have done the third global summit for the partnership for the healthcare system sustainability and resilience out of Abu Dhabi to the globe. And it was great to see that UAE is coming with very solid plans on how they will take this report into actions. And this was very important because we are doing lots of collaboration and initiatives together with the stakeholders, and it was important to link this to what good looks like in the future in terms of, if we will repeat again the report in a couple of years' time, how this would be looking like compared to the baseline that we are starting in this year. Abu Dhabi is leading example of rapidly evolving healthcare landscape regionally and globally. It's continued to inspire being a hub for how to envision the future of healthcare and transform this to health for all. Initiatives like the Emirati Genomes was another big eye-opener because it can open lots of avenues for collaboration in the area of research and is in the area of early diagnosis and detection of patients as well. This was a great opportunity for us, as well as discussing on a broader way how we can leverage digital and artificial intelligence into being a catalyst to transition quickly to the future. So many learnings that comes out of the Abu Dhabi Global Health Week, and I think that they have put the standard very high now. For the next versions of this one, we'll be very much looking into it. But specifically within AstraZeneca, being a sustainable healthcare partner, this was a bright moment. The PHR Summit, and adding to this as well that we brought together some forums around priority disease areas, like we have done lung health symposia that brought together the focus around asthma, COPD, lung cancer, and how we can actually do a policy reforms all together in order to tackle multiple diseases that impacting our lungs and respiratory system by simple changes that we can do on the daily practice.
I think you're right. We all learned so much, and those particular areas were real highlights for many of us. Building on the conversations you had at Abu Dhabi Global Healthcare Week, how is AstraZeneca going to leverage this power of public-private partnerships to do more on these climate-related, health-related intersections, both in Abu Dhabi and across the region?
Yeah, and as I mentioned, I think that now and more than ever, we have a good understanding of the vision of the Abu Dhabi, as well as a report with a recommendation that we can link our partnership to. And as I mentioned earlier as well, that nothing can be done without a strong private-public partnership that includes the private sector, including us. Of course, the government is very much engaged and connected, and we have multiple projects and partnership agenda with the Department of Health, with the M42 on breast cancer, with the Abu Dhabi Data Health Services, and as well as with the academia as well. And what was clear in the Abu Dhabi Global Health Week that Abu Dhabi has the intent to lead and transform the healthcare, and they are much more open to new ideas and partner into providing proof points of what good looks like in the future. It was interesting as well to rethink healthcare into health for all. That this means that the old way of looking into the quality of the healthcare system by the number of hospitals, number of beds, and this is maybe something that could be now out of fashion. And I think what we need to think of is keeping patients away from hospitals and reducing the number of patients visiting those hospitals and through early detection and diagnosis. So this has, of course, we have good foundation of partnership agreement that it's happening now. But I think with the curiosity, with the ambition and inspiration that all the stakeholders have now, I think the sky is the limit when it comes to the private-public partnership, and we can see much more interest now to go into leveraging the data, technology, and new ideas, and provide to the world proof points out of the UAE here on what good looks like for the transitioning of healthcare into health for all. And I think that this would be a fantastic opportunity if we'll come into the Abu Dhabi Global Health Week next year is to show like 2 or 3 big examples to the world of how we can, one policy shaping and change, we can achieve a better health for the people, society, and the planet. And we are able to show that so we can encourage other countries to join the club.
I couldn't agree more. Sameh, this was a fascinating and very important conversation. Thank you for joining us.
Thank you, Lara.
Thanks for listening to this episode of the Health Beats podcast. For more healthcare industry news, visit the Abu Dhabi Global Healthcare Week newsletter. The link is in our bio. Thanks for listening. Like, subscribe, and continue to follow Health Beats by Abu Dhabi Global Healthcare Week for your global healthcare industry digest.